What is the normal volume of semen at ejaculation? Are you ejaculating too little? In today's video, we will address the 6 reasons for the reduction in ejaculatory volume in the reduction of semen. For those who don't know us, we are the Dr. Men's Health Urology channel, where we provide tips and care for better male health. And now let's move on to the video. This is a very common complaint in clinics. Many men arrive concerned about having noticed a reduction in ejaculatory volume, and this can be associated with various causes. Today, we will mention 6 of them here. But before the causes, let's understand what the normal ejaculatory volume is. On average, a man eliminates 2 to 5 milliliters of seminal fluid with each ejaculation. This can vary according to age and functional status of the patient, and there are 3 mechanisms responsible for the reduction of this volume associated with the causes we will mention shortly. The first mechanism of reduction in seminal fluid is the decrease in production. Semen production involves the prostate, seminal vesicles, bulbourethral glands, and testes. Over time, with aging, it is normal for this production to decrease. So the first mechanism is the decline in liquid production. The second mechanism of ejaculatory reduction is retrograde ejaculation, which is defined as ejaculation that goes back into the bladder instead of following its anterograde path, its normal path to be eliminated through the penis. Later, we will understand the causes associated with this retrograde ejaculation. There are several, but initially, it's good to inform the patient that it does not cause any harm. In fact, the semen goes back towards the bladder, and then when the patient urinates, it comes out in the urine. This might only hinder the patient in a situation where he is interested in progeny, wanting to conceive naturally. Perhaps he faces some difficulty due to this condition of retrograde ejaculation. The third mechanism is obstruction of the ejaculatory duct, where semen is produced, but due to an obstruction, it is prevented from exiting. Now, let's move on to the causes. The first cause is related to age, as we mentioned earlier, the decrease in seminal fluid production that is common with aging. The older a man gets, the smaller the volume of ejaculate, and he usually begins to notice this around the age of 50. The second cause is increased sexual frequency or excessive masturbation. It's easy to understand that the more sexual intercourse a person has, or the more they masturbate, the normal to decrease their semen volume. If they spend more time without masturbating or having sex, the ejaculatory volume will be higher. The third cause is medication-related. Here we have various medications that can alter the kinetics of ejaculation. First, medications used in benign prostatic hyperplasia, the alpha blockers. So, medications like tamsulosin, doxazocin, which commonly cause retrograde ejaculation, a symptom frequently reported by patients using these medications. The second type of medication is those that reduce the size of the prostate in the treatment of hyperplasia as well, such as dutasteride, finasteride. They will act to reduce the production of seminal fluid. Other types of medications we can mention are anti-androgens, which block testosterone, reducing sperm volume, some chemotherapeutic agents, and certain antidepressants, for example. The fourth cause is surgeries, such as prostatectomy for prostate cancer treatment. Radical prostatectomy involves the removal of the prostate and seminal vesicles. So in this case, the patient will definitely no longer ejaculate, which is unrelated to orgasm. The patient may still have erections and orgasms, but there will be no ejaculatory content. Another type of surgery that can affect ejaculation is transurethral resection of the prostate, TURP, where the prostate is scraped. This procedure commonly results in retrograde ejaculation, where the semen goes back into the bladder. Other surgeries that may impact ejaculation include rectal surgeries and retroperitoneal surgeries, which involve denervation of paraprostatic structures, also leading to retrograde ejaculation. A common question from patients regarding surgical procedures is whether a vasectomy reduces ejaculatory volume. Well, a vasectomy involves disconnecting the vas deferens from the testicle. Actually, what is produced in the testicle is mainly sperm, which contributes very little to semen volume. Therefore, a vasectomy surgery basically does not alter ejaculatory volume at all. The fifth common cause in our field is diabetes. Diabetes can cause a state of diabetic neuropathy, which leads to denervation, inhibiting the ejaculation reflex in some patients. The sixth and final cause is spinal cord trauma. Some spinal cord injuries, depending on the level, will compromise the ejaculation reflex, and the patient ends up being unable to ejaculate, in some cases needing vibratory stimuli to ejaculate, but this occurs according to the level of the injury. Therefore, talk to your urologist if you have this problem, because it can certainly improve your quality of life significantly. If you found the content of this video important, if you think it will help someone you know, then share this information. Don't forget to subscribe, leave a like on the video, and activate the channel notifications to stay updated on our weekly content. A hug, and see you later.